Most of us know someone who's been there, waiting to see if it is cancer, waiting to see if the cancer's gone, waiting to see if it's come back. Even the best treatments can buy only a few months of extra time. Now, scientists think one approach could lead us to our best hope of a cure, but the money to make that leap is drying up.
Okay, same room. Okay.
Ben Pedro and his wife have flown in from Australia. He was diagnosed with melanoma in 2010. Last year, he found it had spread to his brain. Now, his body has developed resistance to conventional drugs.
The key thing is that at 2 or 3 hours after the treatment, you get a temperature, typically 39, 40. You start to shiver and shake.
So he's about to try a new approach, one that enlists the power of his own immune system to fight the cancer. He's only the third person to try this pioneering new treatment here in the UK.
You should keep that anyway.
The goal is to look for something with a more promise of a durable response, or complete, hopefully even a complete response that can last for several years, if not, indefinitely. So the therapy that's being developed and being administered here is something that does hold that promise. So that's why I'm here, putting my hand up for it.
This is a melanoma cell being attacked by 2 killer T cells. Killer T cells are in the body's front line of immune defence, and scientists want to use their power to fight cancer. They've already found they can do this by stimulating their production with drugs. Now they're working on a new approach, taking killer T cells out of a patient and growing more of them, creating an attacking army that can be safely re-injected. This whole approach is called immunotherapy.
Tonight, there is some good news to report in the fight against cancer. An experimental treatment for leukemia.
In America last year, a team at the University of Pennsylvania reported a major breakthrough for immunotherapy.
I'm now in a position of full health, no cancer in my system.
Dramatic improvement in 3 leukemia patients. 2 appeared to be cancer-free a year after treatment, an outcome greeted with excitement around the world.
Morning, Stan. Nice to see you again.
And here in the UK, there have been similarly dramatic results. Stan was diagnosed with gastric cancer in 2004. Chemotherapy helped shrink his tumour, but by 2006 it had grown again.
That shows, again, a large tumour in the liver there. That was
Professor Hawkins of the Christie Hospital in Manchester began treating him 5 years ago with a drug that takes the brakes off his own immune system. It's one of a handful of drugs to show remarkable promise.
This is your scan from 5 years ago, and that's a tumour in the liver there. And this is the one a couple of weeks ago. And now we can hardly see these. There's hardly anything abnormal there, but it's also been sustained for a long period of time.
Well, that's very encouraging, really.
It's extremely encouraging. Well, it's a quite remarkable response, and I think there's no doubt it's due to the effects of T cells in his body. So I think what it shows us is that if we get this type of T cell right, we should be able to get that on a reproducible, probably not in every patient, but in a high proportion of patients. But I think we do need to do more trials to test that and probably to improve the process further.
How do you feel after seeing Professor Hawkins today?
Oh, very good actually, very good. It was enlightening to see the scans and for him to explain the way he did. And it's given me a bit of a boost really, because I know now that, which I always know, that the treatment is working, but to actually see it on the screen is very, very encouraging.
His tumour hasn't gone, but Stan is now in long-term remission. Ben's on his way to undergo the first part of his treatment. This goes one step beyond Stan's. He's having a melanoma tumour on his shoulder removed. The team will search inside the tumour itself for killer T cells, telltale signs of Ben's body fighting back.
All right, ready to go? Yeah, good to see you.
The idea is to multiply up these cells outside his body, then re-inject them to do their job.
These new immunotherapies over the last couple of years have really given us great cause for excitement, especially for patients who have more advanced diseases, because really the options for them are somewhat limited. So some of the effects we've been seeing recently with these new therapies have been really quite encouraging, and I'm sure that, they're only going to get better over the course of the next few years.
Right, I thought that's probably the case, yes.
Angus Dalgleish is one of the UK's leading experts in clinical immunology. His groundbreaking work on HIV helped uncover important clues to the way the immune system works. He's been applying those clues to the fight against cancer. One vital clue was that tumours themselves cleverly dampen down our immune systems.
If we can reconstruct the immune system that's been suppressed in patients who we can't take the tumour out because they're inoperable or there's too much, then I think that's the first in the building block. You bring the immune system back to normal before you do anything else, because then when you give chemotherapy or radiotherapy, then that treatment is more likely to work. And it's recently been reported that with people on one of these new antibody treatments that takes the brakes off the immune system, allows it to be functional again, when you radiate a tumour, because it's just a little bit too big, that the other tumours will disappear as well.
The treatment matters so much for Ben because his tumour has developed resistance to the best that chemotherapy can offer. The question is whether the team can retrieve enough tumour material from his shoulder to work with in the laboratory. Then they have to hope that any killer T cells they find inside that material will grow to form a colony large enough to help Ben.
Immune therapies like Ben's have made huge strides in the last couple of years, and the UK really has a chance to lead the world, but they face a hurdle to get to the next stage, and this time it's not about science, but it's about money.
It's revolutionised what we do. We use this all the time. You'll have a group of chemists interacting with the structure in 3D, designing molecules and going and making those molecules.
Paul Workman is head of the Institute of Cancer Research. Scientists here use the latest in 3D visualization technology to design new drugs against cancer, working out the best structure atom by atom by manipulating them on screen.
You can be deep inside the structure with a design team, a group of chemists and biologists, and saying, here's a cavity, here's a pocket in the protein that we're trying to hit. How can we design a molecule and capture its 3D structure?
The science is exciting, but it's struggling to get beyond the lab.
Well, right now we've got a combination of the most exciting science and the most frustrating financial situation. We've got the cancer genome, we've got immune approaches, we've got incredible science and incredible ideas, and we can't fund it. So we have to come up with creative approaches. It has to be some kind of partnership between industry, between government, and from non-profit organisations, charities, philanthropy, that will bridge this valley of death between excellent basic science and pharmaceutical development.
Since the financial crash, money for new research has been drying up. Cancer researchers would normally look to venture capital or government or charities to help take their work forward. Britain's largest cancer charity has found it so hard to secure money and partners, it's set up its own cancer investment fund. Cancer Research UK's commercial arm is spending £25 million, with equal funding from Europe, on this new investment strategy.
Last 5 to 10 years, there have been far fewer new small companies that we'd historically have used as our development partners formed, because of what's happened in venture capital, and secondarily the industry has migrated away from early stage research, so we've really found it difficult to find places to partner these projects, so we've needed to do it ourselves, and the fund is a mechanism to do that.
Scientists at Paul Workman's Institute recently published exciting work on one form of immunotherapy, using a virus that hitches a ride on red blood cells, travels straight to a tumour, kills the cancer cells and triggers the immune system to attack, a bit like a vaccine. So is there more that politicians should be doing to make sure the UK stays at the cutting edge?
government can facilitate many different aspects of this. It can help with funding of basic science in the universities and research institutes. It can make it easier for industry and for biotech to operate and to be successful. And it can act as a catalyst for pulling all of these activities together in a consortium for the good of cancer patients around the world.
And is that happening to best effect at the moment?
I think good efforts are being made. I think more can be done.
Sue, I think this is what you're after. There you go.
Ben's tumour sample, and hopefully the killer T cells it contains, are now ready to travel from the hospital straight to the team's cell laboratory a few miles away. Here, they'll be carefully nurtured over the next few weeks.
The main hope is for a complete response, but even if that doesn't occur, if it's some minor shrinkage or if it's some stabilisation, then at least that is a major benefit, because then, you know, obviously down the track something else comes along and I'll have access to that.
4 weeks later and we have an update. The team found relatively few killer T cells in Ben's sample, but these have grown well in the lab and will be ready to re-inject into Ben in early August. Whilst nothing is certain, he's been told the treatment does have a 50-50 chance of working. Drug resistance is one of the biggest challenges in the fight against cancer. Doctors need a new weapon, and many scientists now believe that answer lies within ourselves, our own immune systems. But unless we find a way to pay to take research like this beyond a handful of patients and attract in further funding, then however good the science, other patients, like Ben, will have to carry on waiting.